My name is Marissa Garcia, and I'm a student at San Diego State University looking to pursue a career in healthcare. Currently, I'm a healthcare worker concerned for my future health once I begin my career at a hospital. Many Americans are under the impression that hospitals are a safe place to be when they are in need of care. In reality, hospitals are one of the worst places to be when you are in need of treatment for an injury or illness. According to the Centers for Disease Control and Prevention, about 1 million people contract an infection while staying in a hospital. Many patients come into the hospital for one thing and may come out having to be treated for another. Being that I work in a healthcare facility, I can agree with the fact that hospitals are infested with bacteria. Days go by where I see other healthcare workers providing care in a very unsanitary manner or go from patient to patient without washing their hands. Many of these workers may be careless, uneducated, or simply have no time even just to wash their hands before they visit another patient. According to a study by the University of Maryland, 65% of healthcare workers admitted that they hadn't washed their lab coats in a whole week, and 16% stated that they hadn't washed their lab coats in a whole month. If you don't know, lab coats can be covered in bacteria as workers move from patient to patient while their lab coats rub against various objects around them. It is dangerous to use the same coat over and over because bacteria is invisible and can live for days, even weeks. In another study conducted by Johns Hopkins Hospital, they determined that successive hand washing was inadequate due to the fact that hospitals are so dirty. Healthcare workers' hands become contaminated with bacteria as soon as they touch surrounding objects such as cabinets, curtains, keyboards, or even supply closets. I myself am in constant fear that my hands are dirty, so I feel the need to wash my hands over and over. There is no way of knowing if your hands are still clean once you've touched a doorknob, because many times healthcare workers open doors with the same dirty gloves they use to care for the patient. For this reason, a coalition between healthcare workers and healthcare facilities needs to occur for the benefit of our society's health. A healthcare facility is any place that provides health care such as hospitals, clinics, outpatient care centers, specialized care centers, nursing homes, etc. I work at a nursing home that typically cares for the elder. It is important to maintain a clean and proper facility as the elder's weak immune system is susceptible to everything. According to the CDC, hospitals see more than 200 million patients each year, with some averaging a 5-day stay. That is a huge number of traffic and germs that go through hospitals each year. This also doesn't include the healthcare workers that are there a majority of the time. I myself, being a certified nursing assistant, am part of the healthcare worker community. Among this community are surgeons, doctors, nurses, paramedics, medical administrators, and many more. Specifically, in my healthcare facility, a recent bacteria called carbapenem-resistant enterobacteriase, or CRE, has been discovered. This bacterium is highly resistant to drugs and is known to be very deadly. About 50% of patients who become infected with this bacteria die because there is nothing that can be done for them their already sick bodies. CDC director also stated that this bug evolved due to overcrowding and the lack of time to clean hospitals. To make this bacterium even more deadly, it is known to make other normal bacteria in your body to become resistant, such as E. coli. MRSA, or methicillin-resistant Staphylococcus aureus, is the most common bacteria found in healthcare facilities around the nation. This bacterium is also resistant and very hard to treat once you have been infected. A coworker of mine had an experience with MRSA, and it was one of the worst things I've ever seen. She had a huge gaping hole on the top of her wrist that was oozing with pus each day that bacteria grew. It is scary to think about getting the same infection simply because my workplace is not very clean. It took about 6 months for her hand to be clear of the bacteria, but there is still a scar on her hand that reminds her every day of that terrible experience. You may be thinking, don't hospitals get inspected for cleanliness? Well, surprisingly, hospitals, even the operating rooms, are exempt from being inspected for cleanliness. Hospitals are inspected and accredited by the Joint Commission, but they do not check the level of cleanliness in hospitals. I am unaware of the factors causing this lack of care for the cleanliness of hospitals. The CDC used to test hospitals for bacteria, but something always came up, so they stopped because it became unnecessary and not cost effective. In my opinion, they should continue to test bacteria because there can be other deadly bacteria that have emerged. The CDC also began to underreport bacteria in hospitals, which gave them the attitude that they didn't need to do anything. This shocks me because it is their job to prevent disease amongst the general population. Due to the lack of urgency to help increase hospital cleanliness, a coalition with healthcare workers is vital for healthcare facilities. Healthcare workers are in grave danger of contracting and even spreading all these deadly bacteria. Since the Department of Health or CDC doesn't find it necessary to worry about cleanliness, it is up to the workers themselves to improve cleanliness. They are the ones that spend hours each day in a bacteria-infested workplace. If healthcare workers band together to clean the facility's equipment, then there can be improvements seen in regards to cleanliness. Researchers of Rush University Medical Center in Chicago found that when they trained staff to clean surfaces and overlooked equipment such as telephones and faucets with detergent, the spread of infection was reduced by 2/3. This is an easy task that can benefit facilities for the long run. It may not be an easy one, but it is much better than contracting a MRSA infection. A little bit goes a long way.